Via Skype, Dr. Tushar Patel joined us from New Jersey with lots of important information on the outbreak of the coronavirus, covering various aspects of this health crisis in the world and his comments on the essential need of social distancing. Medical professional right now, what are those key factors that have been missing and things that have the doctors worry in case of the coronavirus right now? Your take on that?
So currently the state government, local government and the federal government is responding to COVID-19 situation. It's a public health emergency. Even WHO declared a pandemic last week. So the best thing right now is to ensure we follow the local, the state and the federal government recommendations of staying home. If you are sick, stay home. If you are non-essential personnel, stay home. If you don't have to go to work, if you have a telework schedule, or if you can work from home, or if you have availability of flexible work, you ensure that you follow that recommendation given by the local and the state and the federal government.
Doctor, were you anticipating this kind of an impact? We're talking about several states shutting down high schools and universities. We're talking about, a potential lockdown in certain epicenters. Your take on that? Were you expecting this as a medical professional?
No, I was not expecting this much, but I think this is a wise thing to do. It's a little delayed, but I think it's a wise thing to do because the containment, the isolation, the quarantine, these are the big steps we need to take at this point to ensure that we can stop the spread of the coronavirus COVID-19 in the state and in the country.
A quick insight into age breakdowns and perhaps, the age groups, especially from the South Asian diaspora, the people that should really watch out for symptoms and their health.
So the most common age vulnerable to this is age 60 and over. The second group is people with chronic medical conditions, heart disease, lung disease, kidney disease, diabetes, people who are immunocompromised, patients who are taking cancer treatment, pregnant female. All those people are at high risk of catching disease. South Asian, we have a lot of people who has comorbid conditions, diabetes, hypertension, cardiovascular disease, kidney disease. So they are at risk of catching this disease. The best thing for them to stay home, avoid close contacts with people who are sick, avoid touching eyes, nose, face and mouth, and wash hands frequently.
Your take on how it's impacting our everyday life right now in America?
So the best thing right now is social distancing is most important and effective, which is strategy in reducing the spread of COVID-19. It means reduce close contact between people to slow the spread of infections. Social distancing measures including limiting large groups of people coming together, closing buildings and canceling the events. If you are home, the best thing is if you have adult home, father, grandfather who are old age, don't try to give them the virus if you are outside. So to ensure that the older age population is safe, make sure they are isolated, not necessarily they're isolated in the room, but avoid close contact with those individuals because the young people can carry the virus and give it to the older age or the susceptible individuals who has medical conditions or who are in that risk age group.
Doctor, we keep on hearing that you should maintain a 6 feet distance between you and a person, or perhaps 3 to 6 feet. Your suggestion on if you're living in a household and currently with school shut down, nation on half of a lockdown, what do you recommend in that in spacing from family members amongst, and also, we're here in the studio, we're still working, suggestions on that?
So the best thing, if your household, if you have seniors, the grandparents are home, ensure that they don't come into close contact. Means they don't hug, they don't shake hands, they don't share items. I think those are the common sense approach you need to take. You can carry on with daily life,
Right.
if you are not sick. If you are sick, you want to ensure that whoever is sick is isolated or in for 2 weeks, or contact their primary care physician
Right.
if they fall into the category of getting the testing based on the history and physical examination.
Your take on how much should we worry about our children's health and well-being, and also their mental health care, with so much happening around them at this time?
So children and young adults are mostly safe from getting COVID-19. And even if they get ill, the symptoms are very mild. Younger age group, especially healthy individuals without any underlying medical conditions, are not at much risk. However, like I said before, they can bring the virus home and infect their elderly parents or grandparents, which is the most concern right now.
Right. In your latest stats that you may have received, doctor, are we still seeing the highest number of deaths in the older age groups, as it's been reported by many media outlets?
Mostly deaths are, like I mentioned, is the older age and people with chronic comorbid medical conditions. Haven't seen many cases where the young healthy individuals die for COVID-19.
You know, doctor, while we are discussing COVID-19 here, I think the biggest concern we keep on seeing across spectrum is the fact that, you know, there's not enough testing available right now for everybody. And also it is really difficult to determine who has the virus and who doesn't, who's carrying it or who doesn't. Your take on trying to detect this virus and how we should all sort of contribute to making sure that we are healthy and we are ensuring that?
So currently in the United States, not everyone is encouraged to go for a test. So if somebody is feeling sick, if somebody is falling into the category of coming from a country where they came across with COVID-19, the best thing to call or discuss with their primary care provider and have the symptom screening and provide the accurate history to the physician or the healthcare provider. If they return from COVID-19 infected countries. If they fall into category of high risk for an exposure, the primary care physician or the hospital can order the test for you. But there are no currently test centers where someone can go and self getting that test of COVID-19. So that is not recommended by CDC, that is not recommended by the federal government, that is not recommended by anyone right now in the US. Unlike other countries, few other countries have the self ordering the testing. They can go at the test center and get the testing done. In the US, that is not the case.